Insomnia is a really common problem, and a lot of people think that they have to turn to medication to improve their insomnia. The reality is that there is a specific type of therapy that is the most effective treatment that we have for insomnia. So today we want to talk to you about CBT-i, or CBT for insomnia. I'm Dr. Nichelle Haynes.
I'm Dr. Krista Lassiter.
And this channel is Medical Mamas. We give you the real deal information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Based in science.
So I think it'd be helpful to first describe what is insomnia, because I think there can be misconceptions around what that even means. And essentially, insomnia is when someone is having trouble falling asleep or staying asleep and getting deep, restful sleep, or they're waking up too early in the morning when they haven't gotten their full night of sleep and can't go back to sleep.
Right. Yeah, I think those are kind of like the three general categories that we would call insomnia. So if you're feeling like you're not getting enough sleep and you're not rested, I would consider thinking about insomnia.
So it's not your pet or your baby waking you up.
Aha. Yeah.
That is not insomnia. That's not in your control or your brain's control.
Right. Although I will say that, like, if someone gets woken up and then they can't go back to sleep, that might be,
that's part of insomnia.
Like insomnia, for sure. We know a lot of people have insomnia and it feels like, oh, we need to take medication. But some people will feel like, oh, there's different reasons that they wouldn't want to take medication. Maybe if you're pregnant, that may not be something that you're really interested in, or if you're trying to get pregnant, or if you have other complicating factors and you want to just keep things simple so you're not adding in another variable of medication, there will be a lot of reason to look at having another option for you. And we know that CBT-i, or CBT, cognitive behavioral therapy for insomnia, is actually the most effective treatment that we have for insomnia, even above and beyond medications for a lot of cases.
Yeah, I think that our typical culture here in the United States is to immediately turn to medication. Like, I have this problem, give me this medication. But for insomnia, it's actually doing these cognitive behavioral therapy techniques that are most effective in treating it in the long term. So yeah, if it's something like brief that you're having trouble sleeping with because maybe you're on steroids or something, I don't know, then maybe I could understand like going to medication first. But really the first line treatment should be CBT-i.
So CBT-i might differ from other forms of therapy in that it's a specific number of weeks. It's 6 to 8 weeks. You have sessions, you talk about very specific things. And I think that contributes to the high success, is that these are the things we are going to do and focus on. Okay, so what are the core components that you would focus on, right? You would talk about just information about sleep.
Yeah, so just like other CBT therapy, a lot of it is based on education. So educating the person about sleep, you're going to learn a lot about information on sleep, but also misconceptions about sleep. The other thing that CBT-i focuses on is sleep restriction, which I think is counterintuitive for a lot of people.
Right. So I've had people who have been through CBT-i come to me and they're like, I thought it was bonkers that I'm going to someone and talking to them about how they can't sleep, and they're telling me you need to reduce the number of hours you're in bed. Right. So I've had people,
And the number of hours you're sleeping.
Right.
Yeah.
So people say like, oh, I feel like I get about 4 hours of sleep. And they're like, okay, go to sleep 4 hours before you want to get up. And people are like, oh, I am actually getting more than 4 hours of sleep at night, because those 4 hours feel really short.
But also a lot of times when people have insomnia, they're staying in bed for too long and sleeping kind of at random times of the night, and or they're taking naps during the day. So they're getting their total number of hours of sleep. It's just kind of broken up all throughout the day. Mm-hmm. And that is contributing to their insomnia. And so one thing that CBT-i does in the beginning is restricting your sleep, because you also want to get the person a little bit sleep deprived so that when they're in bed going to sleep, they go to sleep.
Mm-hmm. Right. It like sort of resets that natural drive to sleep at nighttime, as we are supposed to as humans.
Yeah.
Okay, so the next thing is it's one of the things that we talk about a lot in our videos, and we would put under the category of like stimulus control. And this is basically just like creating an environment that's conducive to sleep, right? That you are not using your bed for other things. Like you're not watching TV in bed, you're not working in bed, you're not doing other things because you want your brain to associate bed with sleep, not bed with activation or tossing and turning.
Similarly, not having light on at night or watching TV, or I cannot stand when people fall asleep with the TV on. That just drives me nuts. That's so bad for your brain. I know a lot of people do it. I'm not judging.
Oh, I've done it. Oh, I have definitely done it for sure. Yes.
But yeah, so it's also including like the environment in which you are sleeping in, including when it's morning time, the environment of what wakes you up.
And in that stimulus control is if you are not sleeping in your bed, you find yourself tossing and turning, they usually get out of bed.
Yeah. Don't stay in bed.
Right, exactly. And then the next thing is looking at different ideas that you have about sleep, right? And this is so common in the postpartum period where I hear people, and it's mostly just an expression of how tired they are, but you're like, I don't think I'm ever going to sleep again.
Or you get all these anxious thoughts around sleep, like, oh, if I can't sleep, then this happens, then this happens, then that happens.
Oh, the rabbit hole of sleep.
Yeah.
Or the mental sleep math. Okay, if I get 5 hours, if I get 4 hours, okay. And then they kind of go into these thought patterns. And I have had patients that I've honestly done this myself too, right? It's like, if I only get a certain number of hours of sleep, in my brain, somehow I'm homeless. Right? Does that make sense?
No, but yes.
Why it really tiring. It's like, okay, you're not going to sleep very much, and then you're going to do bad at work, and then you're going to lose your job, and then you're not going to be able to afford your sleep.
No, it's finding what are those thoughts and beliefs that you have around sleep or around what is preventing you from falling asleep, and really being able to tackle those thoughts and restructure them or distract yourself from them or have healthier thoughts around sleep so that when you get in bed to go to sleep, you're just going to sleep.
So those are the components of CBT that we would be utilizing. Also, maybe some relaxation techniques to help you kind of get like, when you're in bed.
Yeah, there's one that I love called progressive muscle relaxation.
Yes.
That is taught a lot in CBT-i. And the cool thing about that is you can find it on a lot of these meditation apps, and it'll be guided progressive muscle relaxation. So that's always something that's just fun. Even if you just want to take a nap one day and you're like, let me just lay down and relax.
Yes. So CBT-i, there was some information about CBT-i being really effective for people in perimenopause, but they have vasomotor symptoms like hot flashes, to restructure the thoughts around that they're going to contribute to poor sleep. And so I think there's lots of different applications of CBT-i, and we really recommend it for anyone who's struggling with their sleep.
Yeah, I've had patients who are pregnant do it, and so they're able to treat their insomnia during pregnancy without any medications. I think the sleep restriction in pregnancy can get a little bit nerve-wracking for some people, but it's just a week or two of that, and then you're sleeping better the rest of your pregnancy.
Oh, wonderful. Okay, let us know what questions you have about CBT-i. I will include some information.
And check out our other videos about sleep. We have a lot of great videos on like sleep hygiene techniques too, which is really important for insomnia.
Right, that's one of the big components of CBT-i. Yeah. Okay, thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.